First at 6 o'clock on WYFF News 4, atop measles, whooping cough, and chicken pox all making a comeback. The flu is filling urgent cares across the Carolinas.
And doctors tell us this year's strain doesn't fully match up with the vaccine, and holiday gatherings are spreading the virus even more. Our Peyton Furtado is live with what you can do to stay healthy or to keep from getting sicker. Peyton.
Yeah, Sydney, Nigel, we know hospitals around our area trying to stop that spread. Prisma Health, Bon Secours, St. Francis, and the downtown location as well. We've got Spartanburg Regional and now Advent Health all limiting their visitation for children under a certain age, all trying to stop that spread, which is already spreading fast across the Carolinas.
I'd say they're rocketing up.
As holiday gatherings wind down, flu and other illnesses are just winding up. They're filling area emergency rooms and urgent cares.
Unfortunately, we'll be adding additional flu-related deaths to our dashboard when we update that on Wednesday.
Friday, Saturday, we started to see some people coming in, and it went up exponentially, like almost overnight.
This comes when South Carolina is already seeing more than 3,300 flu cases in the week ending in December 20th. North Carolina, more than 1,600 in the week ending in December 13th. This year's vaccine, not a total match for this year's strain.
But the point is that it doesn't offer 100% protection against the disease, but it certainly helps in preventing complications.
On top of getting the flu vaccine, doctors recommend washing your hands, keeping them out of your face, sanitizing high-touch surfaces, staying away from large groups, a big ask this time of year. And if you're already sick but don't want to get sicker.
So you should definitely be evaluated if you're starting to have severe symptoms of increasing shortness of breath, if you're getting so weak that you have difficulty moving around your house, if you're so nauseous that you're having trouble keeping down fluids.
People who are over 65, children less than 5 years of age, people with diabetes, heart disease, lung disease, those folks should really get tested early in their illness and ask their doctor or pharmacist about antiviral medicines.
If you're just feeling crummy, consider bringing in the new year with some well-deserved rest and hydration.
Mainly water, but then also electrolyte drinks like Gatorade if you need to, Tylenol, ibuprofen to keep your fever down so you reduce the amount of, water loss that you have overall, and then just trying to stay rested.
And Peyton, I'm sure a lot of people will be interested in seeing what these flu case numbers look like after the holidays. When can we expect those numbers?
Yeah, I asked about that today, Sydney. It sounds like for both North and South Carolina, we can expect an update on Wednesday. All the doctors we talked to telling us it's going to reflect that big increase that they talked about with us today. Live in Greenville, I'm Peyton Furtado, WYFF News 4.
Peyton, thank you. And tomorrow, South Carolina health officials will release new numbers related to the ongoing measles outbreak. As of Friday, 156 cases have been reported in the upstate outbreak. 252 people are in quarantine, 3 are in isolation. Health officials say vaccination continues to be the best way to prevent measles and to stop the outbreak. Of those who have been infected, it is reported that 1 person was fully vaccinated against the illness.